Hello and welcome to ecancer's Palliative Care e-learning course for African healthcare professionals. All of our modules begin with an introduction from an international expert.
Welcome to these palliative care e-modules.
The module introduction then contains key elements such as aims, learning objectives, and additional information to support learning. At the beginning of each module, we test the learner's existing knowledge. The educational content is delivered by videos of leading experts.
The hard part is if it is advanced disease, the breathlessness might be there to stay. But as long as the family members understand that they're doing the best that they can, then there's a sense of calm.
You have to be really careful how you talk with people, I think, about anxiety, because the last thing that you want to give the impression of is that you think they're just a bit anxious.
I think the most important thing is to make sure that the mouth is clean and moist. That can be quite difficult sometimes with people who are mouth breathers because the mouth dries up a lot more quickly than people who are nose breathers.
So we advise them to advise the patients or the family members to do mouthwash. Usually our mouthwash is just warm water with salt, then you gargle.
The content of these educational videos is then reinforced by displaying the key elements visually. All of the key elements of the module are displayed again in the final summary section. The learner's knowledge is tested again with the same questions as at the beginning of the module to demonstrate the knowledge they have gained. At the end of each module, there is a final information section which contains additional clinical resources as well as extra information to support continued learning. The learner's experience is then evaluated to help continually improve our resources. The key aim of any module is to improve the long-term clinical practice of the learner, which then drives improved patient care. To do this, learners are asked to reflect on what they have learnt and how they will change their clinical practices. We email the learners at 1 month and 3 months after the module has been completed to see if they are implementing what they have learned when they are treating patients. By helping to improve clinical behaviour at the point of patient care, ecancer's modules achieve the end goal of all medical education, that is to improve patient care and outcomes. Thank you for taking this short tour of ecancer's online educational modules.